Welcome to Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. This is episode 36 and the last episode of our first season. Whether you've been listening all along or are new to Hands on Health, I want to thank you for joining us in this journey. Although our health experts have talked a lot about COVID-19 over the past few months, we've also explored a myriad of topics, like how to get back into exercise, the difference between food allergies and intolerance, recognizing and responding to grief, protecting your student-athlete's brain health, and why you shouldn't ignore pain during sex. I hope you've enjoyed the journey as much as I have, and I hope you'll join me again in the fall for Season 2 of Hands on Health, when we'll focus on resiliency. We'll talk about building resilient bodies and communities. Now, let's meet today's guest.
My name is Emily Sullivan. I'm a pharmacist. I work at the CMH Community Pharmacy in Seaside, and I am a board-certified ambulatory care pharmacist.
I snagged a bit of time with Emily in the pharmacy between patients. If you haven't had a chance to watch a pharmacist work, let me tell you, they're amazing. Pharmacists have to be exacting and focus on the details over and over again as they fill prescriptions. And the best pharmacists are also approachable and warm, ready to answer questions and give advice to anyone who needs it. I'm so glad you've joined me for another episode of Hands on Health. Welcome, Emily.
Thank you for having me.
Yes, I'm glad to have you. You have a title that I had never seen before. And so just to let our listeners know, I ran into you one day in your capacity as a pharmacist, and you were filling a prescription for one of my kids. And so I said, hey, Emily, come on the podcast. So here you are.
Yep, here I am.
So thank you for being
I was a little nervous
willing.
at first. Thank you so much for inviting me.
Yes, well, I wanted to bring you on because I have not heard that title before. Would you give us an idea of what an ambulatory care pharmacist does?
People may not realize that pharmacists can specialize in different areas of medicine. An ambulatory care pharmacist has extra training and experience specifically geared towards taking care of people with chronic conditions. Commonly, these are things like high blood pressure, diabetes, chronic pain, depression or anxiety. The list goes on, but generally conditions that people have to manage for a long time. So an ambulatory care pharmacist typically works in a clinic setting. It could be a primary care clinic or it could be in a specialty clinic. And generally, they're seeing patients just like any other provider, a doctor, or a nurse practitioner.
Okay. So, a lot of people have a chronic condition and a lot of people have medication for chronic conditions. And so, they might get to know their pharmacist pretty well. But you said something about having appointments with people who have chronic conditions. So just like you'd come in to see a nurse or a doctor, people can come in to see you?
Absolutely. So it's nice to be able to sit down with a pharmacist and really have the time to review medications. Of course, medications are such an important part of healthcare. They can keep people feeling well, and they can make people feel really unwell if it's the wrong medication. They can keep people out of the hospital or, again, put them in the hospital. So sitting down with the pharmacist to review medication, the pharmacist looks to make sure that there is a reason for each medication. You'd be surprised how many medications kind of stick around just because the person's been taking them for a long time and it gets kind of set on the back burner. So we make sure that there's a reason for every medication. We make sure that it is not causing any side effects or other problems. And we make sure that it actually makes sense for the person. So if it's an inhaler, are they able to demonstrate correct technique with inhaler? If it's an injection, are they able to inject themselves? Do they have the dexterity to handle small pills or the eyesight to be able to dose certain things? So just those practical pieces of it. We also look for things like drug interactions. A lot of times people have medications that are prescribed by different providers. and they're not always in the same healthcare system. So some people might have a primary doctor at CMH, but go to Portland for their specialist. And the computer systems don't always talk to each other. So it's nice to have someone that's looking at the big picture, all of the medications prescribed by different providers. Oh, the other
Hmm.
thing that I really like to look at, Felicia, and really like to ask about are things like over the counter medications and supplements. Those often also get forgotten about. People don't realize that over the counter medications can also have drug interactions, and same with supplements. So, a good example, things like fish oil for people who take blood thinners. That's something that I'm always looking for, or people who take biotin might not realize that that supplement can interact with some laboratory tests. So it's nice
Hmm.
to really take a magnifying glass to those types of things.
Yeah, and I think often if you go into the doctor's office, if they're not specifically asking what you're taking, or let's say you take, maybe you take a lot of painkillers because you tend to have back pain, you don't necessarily
Hmm.
think about that being a medication that you are on, for example. But
Exactly. Yep, that's exactly right. You're asked about which medications you're on, and the over the counters or supplements don't always come to the front of your mind. Exactly.
hmm so, as an ambulatory care pharmacist, can you see just any patient or any person who's interested?
That's a great question. I love talking to anyone who is interested. I love talking about medications, giving them information, and I can make recommendations to them and their healthcare team. However, I have been involved in a newer project here with one of our primary care providers at the CMH Primary Care Clinic in Seaside. So, what Dr. Boone and I have done is created a collaborative practice agreement. What this is it's an agreement between Dr. Boone and myself for his patients who have high blood pressure. So our agreement says that for the people that he refers to me, I can change their medication if that's appropriate, if they're having side effects or if it's not working. I can help them pick a different medication or change the dosage. I can order labs to make sure that that medication is safe for that person, and Dr. Boone and I work together in that aspect. And it works really well because primary care providers can be so busy and it's not always easy to get an appointment to be seen there. So it's nice to have someone else on the team that is not only focusing specifically on the medications, but also just another person to have access to, another person to ask questions of, and it takes a little work off his plate and it gives the patients a little bit more information and one extra resource. So, yeah, it works really well.
Well, I can already see an application in my own sphere. I know someone who has been on high blood pressure medications for years and then was diagnosed with an autoimmune disease. And in going through
Hmm.
the process of fine tuning the medication for that, it began to affect her blood pressure. And so all of a sudden, her blood
Absolutely.
pressure wasn't as high as it was. And so the medication was too much.
Hmm.
And so I
Hmm.
can really see how somebody could start saying, "Wow, I'm getting dizzy," or I'm taking my blood pressure and it's super low. What's going on? And you'd be a great person to come
Hmm.
talk to about it.
Yeah,
Yeah.
absolutely. And we see that a lot with people who have maybe new or kind of scarier diagnoses, things like cancer, maybe. And that's, the first thing on their mind. And rightfully so. But some of the chronic conditions like blood pressure, again, may be forgotten about. So
Mhm.
it's always good to have that extra eye on it. The other thing I really try to promote in the folks that I see is self monitoring. So I suggest a home blood pressure monitor for all of the patients I see, if that makes sense for them, if they're able to afford one and work it.
Mhm.
And that way, it really puts the information in their hands. It's really common for people to have a little bit higher blood pressure when they come into clinic. I mean, they could be rushing to get here, they could be nervous, they could feel just fine. And for whatever reason, their blood pressure is always higher when they're here. So I teach them how to use their monitor, and I give them the power to monitor their own condition at home when they're comfortable, and at their convenience. So that's a great tool as well.
Hmm. So, what would you say the goal of appointments with patients are? Is it to just make sure they're taking their medication right, or like what's the end goal?
Mhm. Yeah, so just like what I was saying in the beginning, I want to make sure all of their medications have a purpose. Do they have a reason for taking everything? And if they're taking something, is it working? There's no sense in taking a medication if it's not working for them. So that's the second thing I look for. The third, how does it make them feel? Are they having any side effects? Are there labs in a way that's normal for them? And then is it practical? So those are kind of the
Hmm.
four main things. So my goal is to, have people's blood pressure controlled, of course, but also make sure that it makes sense for their life and make sure that they're happy with their health care.
And how often would you meet with somebody to go over
Oh,
their medication?
yeah, that's a great question. So, anytime there is a major change, I think it's a great time to go over medication. So, if there's a new diagnosis, or if they just got out of the hospital, or if they have a new provider, any big change like that is a great time to review medications. For the folks with high blood pressure, usually I see them about every 2 to 4 weeks until we can get their blood pressure at goal and in a safe place.
So you said that you're working with Dr. Boone with this collaborative practice agreement.
Hmm.
Somebody happens to be a patient of Dr. Boone's. How
Hmm.
can they get an appointment with you? And they're on high blood pressure medication, because that's the limit right now with the pilot project that you're doing. But how do they get an appointment?
Yep, absolutely. So I just need Dr. Boone to refer the patient. So all they have to do is ask. They can call the clinic, or they can send a message on the portal, and say, hey, I'd like to meet with the pharmacist, Emily, and he will refer that patient.
Great. Okay. Well,
Yeah,
that seems
I
pretty
will.
easy.
Yeah, it absolutely is easy. And I'll also say, I mean, pharmacists are a great resource, not just for high blood pressure medications, but for a lot of medications. And even if I can't myself change the medication, I'm always happy to sit down with people, look at what they're taking, give them information, make recommendations. If they want me to get in touch with their prescriber, I'm more than happy to do that. So anyone is very much welcome to talk to me. I will also say that the state of Oregon is great in that it has some protocols already in place that any pharmacist could use. So if the pharmacist has gone through a specific training, you can have birth control prescribed in most situations by a pharmacist in Oregon. We can prescribe naloxone, which is a life saving medication. It's the reversal medication for opioid painkillers. We can
Mhm.
prescribe emergency refills for people that are on insulin and their prescription ran out and they need something to cover them before they can get in to see their doctor next. So those are all in place right now, and any pharmacist could utilize those protocols.
And I believe, correct me if I'm wrong, but I believe that both the CMH pharmacy in Astoria and the community pharmacy in Seaside both do all of that, correct?
That's absolutely right. Yeah, that's correct.
Okay. The pharmacists at those locations are all capable of doing that. Because I guess it's
Hmm. Yep.
about your capabilities. It's not the pharmacy as an entity, it's the pharmacist who is
Correct.
certified
Yep.
to do those things. Okay.
Yep. Each pharmacist undergoes a training and signs the protocol and is able to prescribe those things. And all of us at CMH, both in Astoria and Seaside, have done that training.
Okay. Okay. Well, see, that makes it easy. You said it so much better than I
Yeah.
did.
Oh, no, that's the same thing.
Well, okay, so is there anything else? Like, what would you leave our listeners with? What's the one thing that they can do with regards to their prescriptions or over-the-counter medications to ensure that they are taking them safely and to improve their health or maintain their health? What's a piece of advice you'd leave them with?
Absolutely. I guess I would say ask questions. Ask questions. If you're not sure why you're taking something, if you think you might be having a side effect, but you're not sure, if you are just kind of confused, or if you're hoping that there is a way to pare down the number of medications that you're taking, go ahead and ask. If it doesn't make sense to you, if the device is tricky to use, if you don't feel like your inhaler is delivering the right medication or your insulin is being dosed appropriately, just ask. It breaks my heart a little bit when I hear people tell me, oh, well, I have this side effect, but I'll just live with it. I will tell them 99% of the time, you do not have to live with it. There are always solutions. It might take a little bit of work. Sometimes there's trial and error, but usually we can figure something out. So please don't feel like you are stuck with something that you're not comfortable with. Just ask those questions. Yeah.
Yeah. Well, it all comes back to being your own advocate when using.
Oh, absolutely.
When being in the healthcare system. So.
Yep, I couldn't
agree with you more. And that can be really hard. Yeah.
Yep, I couldn't agree with you more. That's also the nice thing about being a pharmacist and working in a pharmacy. We are highly trained healthcare professionals, but you don't need an appointment to come see us and ask us a question. Pharmacists are available almost all the time. And I love that access piece of it. I love that we're available and that we can help people without an appointment. They don't have to, wait several weeks. Yeah, we're here to help.
I never thought of it that way. Yeah. You really can just walk up and say, hey, how do I take this? Or should I be taking this? Or what can I do for an earache or whatever?
Exactly.
Well, thank you, Emily. I know that you are actually in the pharmacy today, and I just caught you at a slow time, so I better let you go because I'm sure that somebody's going to walk in any minute needing your services. So thank you.
Oh, it was my pleasure. Thank you so much for having me.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.